slides here, then I'm going to introduce some of our incredible faculty to speak with you today. So public health is the science and the art of preventing disease, prolonging life, promoting physical health and efficiency through organized community efforts. And that's one of the favorite definitions of public health. In a nutshell, public health focuses on populations and emphasizes prevention. Many big issues in public health, and we don't have time to talk about all of them, but we will talk about a few of the most pressing public health issues. Climate change is an intense public health issue that impacts people in all locations across the world. One of the things that's really important to remember now is science is evidence, not opinion. And as you know, some of the most challenging issues in public health are around communication and misinformation. And that's what we as public health professionals can help people with. And also we teach our students in the program. So I'm going to now turn this over to our faculty to give their perspectives on some current public health topics. You're going to hear from Dr. Elzuri Diego and Dr. Tom Griffin and Dr. Shamima Khan. So next up is Dr. Diego.
Hi, everyone. I'm Elzuri Diego, and talking about guns today. Most of the people thinking about doing the accelerated master's program are in Gen Z. And one of the hallmarks about Gen Z is that you want to find a career that gives you a sense of purpose and hopefully makes you feel like you're doing a little bit of something to make the world a better place. And this is something that I've done that I think has made a very small contribution to making the US a little bit safer. This is a study that we published when I was doing my postdoctoral fellowship at Harvard. We used publicly available FBI records and then analyzed our results. And we found that more people are killed and or wounded in active shooter events involving semi-automatic rifles compared to if there are other firearms present. And one of the cool things about doing public health research is that your findings can have an impact beyond the field of public health. So this paper has been used to support legislation limiting access to semi-automatic weapons. Several judges have used it as evidence in their opinions. One of the judges that used it, the case is currently being appealed, and that appeal process reached a US Justice of the Supreme Court earlier this year. It's cited in an ordinance where a city is trying to ban semi-automatic weapons within the city. And then it's been cited in various amicus briefs, which are legislative documents that support an opinion. And then it's also been cited in testimonies, including in a testimony before the committee of the House of Representatives Subcommittee of Crime, Terrorism, and Homeland Security. And so this is an example of how doing public health research can have implications outside of the realm of public health, and an example of how you can do public health research and it can provide you with a sense of purpose. And that is the end of my presentation, and I will give it over to Tom Griffin.
Awesome. Thank you. Okay, well, hi everyone. I'm Tom Griffin, and I am going to be talking about complex humanitarian emergencies today. And I have a unique perspective that I'm excited to get to share in the sense that I took the classes here in this program. I've taken several courses and now get to see it from the other side with my faculty colleagues. And so what I'll talk about is partly about the topic, but a little bit about how those courses shaped what's now become my professional career. if you just turn on the news today or at all in the past couple of weeks, you've seen a complex humanitarian emergency unfolding in a handful of areas. But beyond Israel and Palestine and the Gaza Strip and Ukraine, there are some in South Sudan still going on, and Yemen and Myanmar, and all of these places where what gets shown on the news is often the bad guys shooting at one another, when there are so many more variables that are at play, and they're in places where civilians are located. So in the upper left is a graphic from a nonprofit organization, so a non-governmental organization, an NGO, that does a lot of policy work and education and training in these settings. And it just highlights that conflict is only one piece, but there are all these other variables at play, from hunger, sexual violence, natural disasters can accelerate these conflicts. So I was able to learn this and see this graphic in one of my courses, which was Health in Humanitarian Emergencies with Dr. Kelsey Gleason, who is still at the university. And it was a great chance to see, to get to learn some of the lingo of what it's like to learn what the UN does in this space. And what it did for me was it helped me in my setting understand what are the Geneva conventions, what are some of the terms in UN humanitarian settings, like the principles of neutrality and impartiality, and that thing. So it made me just a better practitioner. And at the time that I took all 4 of these courses, I was actually deployed overseas with the Army Reserve. And so I'll get to that in a second. But the point of saying that is, prior to taking this course, I used to say, oh, I'm doing humanitarian work for the Army. That was kind of my shorthand, elevator pitch that I would give to folks. But in getting to understand the lingo, I learned that humanitarian work by definition is impartial and it's neutral. So the military should not be saying that you're doing humanitarian work. So it was a good way that I was able to learn, in my speech now, I say that I supported humanitarian assistance initiatives. So that's one thing. In the upper right, also in this, in another course, and in my course today, where I teach environmental health, where we have a case study where we work across an interprofessional setting. So in this setting, I bring in experts in the discussion in our Yellow Dig tool, and you'll get to hear from a media expert and a water expert and a medical expert. And then those in the classroom are expected to be public health experts. And so much of our work today is done in that kind of cross-department, cross-sector, interagency setting. And in the upper right was a setting where I was at the US Embassy in Yaoundé, Cameroon. And I had the US ambassador on my right, and other entities represented were the senior political advisor to the Department of State, the President's Malaria Initiative coordinator, also from the Department of State, a special operations colleague to my left, and then somebody from the U.S. Agency for International Development, USAID, who was representing the countering violent extremism portion of their entity. So again, when you work side by side, that is what these courses enable you to do. Is from them you get to work in your classes as perhaps as undergraduate students. You might be side by side with professionals that are working in the field already. And that's such a cool learning environment, I think, where you get to learn from those that are in the field already. And you get to kind of share your perspective from how does the next generation view certain topics, which is different across generations, as Elzri said earlier. So that's pretty cool. Down below, I took public health law and ethics, which is one of our core courses. And what is, I think, uniquely special about the accelerated MPH program, it means that you're all coming from UVM. And one thing that makes UVM special is our commitment to our common ground. It's something that I developed as a UVM student, and it comes out throughout our courses, and it came out in my law and ethics course. And we talk about the principles of justice and openness and respect, and the things that are on the granite slabs outside of the Davis Center as you walked in here today. I mean, it's something we live and breathe, and in the lower left-hand setting, I was teaching a course in humanitarian and human rights, and it was to the Cameroonian military. Just weeks prior to this, I had been taking courses and I was learning about the human rights things and immediately got to apply it and teach it to a country that was struggling with human rights issues among their military. And what was really cool about the setting in this case was that it was somewhat of a check the box exercise. We had to teach a class with this PowerPoint that was given up to us so that the Cameroonian military could be given certain equipment. But I wasn't satisfied with that because I grew up with the common ground values of a responsibility as one of them. It was our responsibility to be able to talk about human rights. And it turned out to be this great discussion about what does it look like when your boss is telling you to do something unethical in a different environment, and how do you approach that? And so it went from just a PowerPoint slide to the next slide to the next slide to a real discussion, and it's something that I felt confident to do because of the courses that I had taken. And then lastly is on the bottom right, an amazing course I took here was Climate Change Emergencies with Dr. Langdon Lawrence, who is still very active in our program. And this was in my very first publication, which there's a conceptual framework about the environment that I was working in and the crazy scenario around Lake Chad and the conflict there. But that was my final paper from the course, and it ended up becoming something that I was able to turn into a publication. And so it just speaks to the fact that our program is rigorous. The courses are rigorous. You'll have great faculty. You're among great faculty that help teach us those skills. But yeah, all in all, I think you can see how every course that we do can really be translated into something that you can take away for your professional lives. So now I'll be passed to you.
Very much, Tom. Hello. Hello, everybody, and I'm Shamima Khan, and I'm an assistant professor here with the Public Health Program, College of Medicine. So today I'm going to talk about obesity, and I'm calling it a silent pandemic. And the reason I'm calling it a silent pandemic is because okay, I need to get my slides. Okay, thank you so much, Tom. Yes, all right, sure. Thank you very much. So I'm calling it a silent pandemic because we have become so used to obesity, we don't realize it really is a pandemic. So now the question is, what is a pandemic? We have heard this word quite a bit for the last few years. A very common definition of pandemic is when everybody knows somebody impacted by it. So now I would ask you to think, do you know somebody impacted by obesity? I know I do. So that's the situation. We all know somebody impacted by obesity. Now I'm going to talk about in general what is going on in the United States. So this is a map from 2012, so more than 10 years ago. So as you take a look at this map, I want you to take notice. What do you see? The colors? Do you see a lot of yellows? I do, right? So let's see where we are. That was 2012. And yellow here means only 25 to less than 30% of self-reported individuals classifying themselves as obese. So let's see where we are kind of today. So this is 2022. Of course, we don't have the data from 2023 because 2023 is still ongoing. So 2012 to 2022, 10 years, how much we have changed. So as you can see right now in the map, we barely have what? A handful of yellow states. And please keep in mind, this is self-reported. So probably the actual situation, unfortunately, is much worse. So now most of the country, we are seeing either deep red, red, or orange. Thankfully, Vermont is still yellow. And so is New Jersey and a few other states. But most of us right now living elsewhere in the country will see that, yes, the situation is really not where it should be or where we want it to be. So the question is, what can we do about it? This is a pandemic, and how do we address it? So with that, I want to talk about where do we want to go from here? And where do we go from here? Did we really want to be in the situation where we are today, with vast majority of the country suffering from huge proportions of obesity, and that is self-reported data? Probably not. So the question is, how do we address the situation? Well, of course, public health comes into play here, because as we see, we need, first of all, awareness. How many of you were surprised to see the map and the slides? I was, when I was preparing for this presentation. I was surprised to see how much situations have changed for 2022. So the awareness is very important. And to see it visually, as the old saying goes, a picture says a million words. So then the next question, we need to create strategies. How do we address this situation? There is a huge part of public health initiative where we need to create strategies that do work. And we do have some strategies that have already worked. We have seen with the tobacco initiative. That has been a very huge success. So somewhat similar strategies need to be implemented to tackle the obesity pandemic. So what do we need for that? Well, we need new AMPH students. We need workforce development, and we need you. So hopefully this will interest you to come into public health, learn more about public health initiatives, how you can be part of the much needed change. Thank you.
Thank you, Shamima. So to go over the program, once you finish switching gears a little bit here from the topics of public health, thank you, wonderful faculty, to the logistical things. And feel free to jump in with your questions for the online students. And we're monitoring the questions and we'll be able to answer them live. So this program is 100% online, which means when you start this program during your senior year, you will be taking those courses entirely online. 100% asynchronous courses offered through Brightspace. And the program is 42 credits. So as an AMPH student, you will be taking 2 or 3 public health courses during your senior year. And then you will do the rest of the courses within the next year to get your MPH, which is 42 credits total. We have core courses and we have electives. So a part of the program is choosing your 3 electives that could be part of one of the area of excellency within the public health, or you can double dip. You can choose your courses in a quantitative area like biostatistics 2 and public health informatics and investigating disease outbreaks, or if you're interested in environmental and global health, or if you're interested in public health policy, advocacy, and leadership, you can choose, pick and choose your courses that way. And we do not have a thesis or a final exam in this program. So the project is where you culminate your knowledge gained throughout the program is part of the MPH Culminative Project experience, where you have an integrated learning experience for 5 credits, and then you also get to apply your knowledge with a mini internship in your last semester, which is 1 credit. And basic courses that most of the AMPH students take in their first year are epidemiology, biostatistics, because you do need those courses to jump into the culminating project experience. Our program is a generalist program. So as you can see, the multiple areas that we're covering throughout throughout the program can take you anywhere in the field. So we don't have specialized with one exception. We have a concentration right now, but this program prepares you for any field within the public health, and that's why we are a generalist program. This is an example of the electives that you can choose. Most of the students choose to take them while they're taking their core courses, and we have at least 3 or 4 classes that we offer every single semester, so the students have a lot of choices. And this is the global health leadership concentration that I mentioned. So you will be taking your general core courses as part of your MPH, but then your electives will be in this specific area. And this is something new that we are offering currently, and which is an option for accelerated MPH students. and everything else stays the same, all of your core credits, core courses. The benefits of being in the accelerated AMPH program is that you start your master's degree while you're finishing your bachelor's coursework. As I said, you can take about between 2 and 3 courses in public health that will be counted towards your undergraduate degree and your master's degree. And then you can take the rest of the courses within the next year, starting in the summer or fall. And keep in mind that it doesn't have to be a year. Some students find jobs, they move, they have things, life happens, and they don't have to necessarily get their master's degree within the next year. So you can definitely spread it out, and you can take 2 years to finish the program if things happen. And you have 5 years to graduate with your master's degree. The application is fairly simple, and the process starts with your dean's office, because you do need to talk to your undergraduate advisor about what courses in public health would be applicable towards your undergraduate degree, and they will also count towards your MPH. You need to fill out a permission form signed by your advisor and then send it to us. We will review the courses that you will be taking. And as I said, mostly it's epidemiology, biostatistics, and then you can choose one of the qualitative courses like public health policy or social and behavioral public health. And what we're looking for is a 3.0 GPA minimum and a background in math and science. You will be taking highly quantitative courses, so we want to make sure that you are prepared to take classes like biostatistics and epidemiology. And so we are asking that you have at least a college algebra or statistics course and a basic understanding of science. You will have to fill out the application, the graduate application form, along with your permission form and 3 letters of recommendation. And one of the letters has to be from your UVM faculty currently. We do accept students year-round, so the upcoming summer deadline is April 1st, and for the fall semester, it's May 15th. But we do have a few students who do start in the spring in their last year. If they are able to take 2 public health courses before they graduate, it is possible, and that deadline is coming up on December 1st. We have personalized advising, and all of our students get 2 advisors. One would be a program advisor, which is me, and you come to me for any questions regarding course registrations, mapping, the timeline for the program, etc. And you will also be assigned a public health faculty advisor, who are the experts, and they will be able to help answer any questions pertaining to the field of public health, emerging trends in the MPH fields, and also with some of the career choices. And we also have a career coach that helps you with all of those things in the program. So you get the personalized coaching experience as well. We do encourage students to meet with their advisors on a regular basis. We are available to meet via phone or Teams, and we will tailor the program to meet your needs. So if you change your mind and if you say like, well, I can't take a year, I need 2 years, we will meet, we will go over your MPH plan to make sure you still graduate on time. And you do take the courses that would fit your schedule. And as I said before, the generalist program can take you in any field you would like to go to. And we have an extensive network of MPH alums right now. We have a LinkedIn group with almost 200 members right now, and it's growing. So you are able to make the connections with our alumni based on either geographical locations or any field within the public health that you see yourself in. And these are just a few of the professions that our students are in right now. And from that, I would like to introduce 2 of our AMPH students who are currently in the program. So they gotten their bachelor's degree and now they're doing a year. Julia and Libby, thank you for being here. And I would just like to ask them a couple of questions. And then if there are any questions from the students online, we can fill those too. So thanks for being here, Julia and Libby. Can you tell us a little bit what brought you to the field of public health? First question.
I actually have kind of an unusual public health introduction. My high school had an infectious disease course that I decided to take, and I hadn't been able to identify what I was passionate about. I knew that I liked science. I knew that I liked why things work, why are things happening, problem solving. But that was really a course that clicked for me. And my teacher noticed how much I liked it. And she pulled me aside after class and told me that if you want to go into the public health world, you don't need to necessarily become a doctor, a medical doctor. And she actually educated me about MPH programs. So from that point, I was really passionate about getting into the public health field.
Yeah, no. So I came in as a biology major and I thought I maybe wanted to work in healthcare. My mom works in healthcare, but I wasn't quite sure what exactly I wanted to do. And my first semester was fall of 2020. So I figured it would be good to take a public health course with COVID going on and whatnot. And I ended up just really liking it. And then from there, I switched my major to Health and Society, one of kind of the undergraduate programs here at UVM that's more public health focused. And then I heard about our MPH program and knew I wanted to continue my education and focus more on some of the quantitative study. My undergraduate is a little bit more qualitative focused, so I really have liked that about our program here.
Thank you. My next question would be, what courses did you take during your senior year? And do you have any advice on how you balanced your undergraduate coursework with graduate level public health courses and how you kept that balance?
My senior year, I did the summer start. I believe I took health policy, and then I took epidemiology 1 in the fall and biostats 1 in the spring. Balancing, I found it very easy to balance the classes. I didn't have any summer classes, so I got a great introduction to what the pace and course load of the program was. The summer classes are accelerated, so they're in a period of 6-7 weeks instead of 14-15. So after I got through that course and kind of adjusted to that type of course load and the quantity and quality of work that we have to put out as master's students, I felt confident in the fall that I could accomplish both of them, and I did. So I feel very confident now.
Yeah, so I took the same 3 courses. I took health policy and then epidemiology 1 in the fall and then biostatistics 1 in the spring. And I thought that taking like 1 online class per semester honestly like balances your schedule really nicely, and it gives you a really good preparation for the following year where you're taking full-time online. And I thought it just like supplemented my classes really nicely to have 1 in a different learning modality.
Thank you. And can you speak a little bit about online courses, how you found it? Was it easy for you? What did it take? Did you find it easier or difficult to take online courses? And how do you feel now that you're a full-time MPH student?
Being undergrad during before and then during COVID, I did get some experience being online. Even though that wasn't what I expected when I started at UVM, I think it really helped prepare me for the program. Online classes is surprisingly something I enjoy. And what I would say about this program is even though it's completely remote, it can be as hybrid as you want it to be. You can meet with your fellow UVM peers, especially during your senior year. You're still on campus, you're still in the Burlington area. Livy and I were both in the same major undergrad, so we've actually collaborated on a bunch of stuff. And then those connections that you make undergrad, I know, like, for instance, Libby, other students, I feel like I can reach out to people in classes and say, hi, do you want to work on this group project together? I'm struggling. Did you get this assignment? And the capstone project that we do is a great way to build further connections in the programs with people that you necessarily wouldn't talk to or meet outside of class. So it's great. And I do feel very connected within the program. So
Yeah, I feel like also starting college during COVID, I got a lot of online experience. And while I admit it probably isn't for everyone, I found it really nice. And I found that it allows me to balance the other things that I do outside of school a lot better. I'm currently working for the city of Burlington. I'm a student athlete, and those things I have a lot more time for when I'm doing online classes, and I'm able to structure my schedule around other things that I'm doing. And also, if you're Burlington based while taking it, you still have full access to the library and a lot of resources. So you're able to kind of feel more student like if you're going up to campus or even trying to meet with faculty in person. You're able to get some of those more in-person experiences.
Thank you. My last question would be, and then we can address the audience, what you're hoping to do with MPH once you get it.
I'd really love to go into the epidemiology or biostatistics field. I undergrad, I was health and society, so I did a lot of qualitative research and I strangely love numbers. I like math, I like that stuff. I would love to be able to work with data and really make a difference in the public health field.
Yeah, no, I really enjoyed the quantitative aspect. I'm taking an elective right now, emerging outbreaks or investigating disease outbreaks, and I've really enjoyed that. So I'm thinking something in epidemiology. Otherwise, I think harm reduction and substance abuse prevention are really interesting topics.
Thank you, Julia and Libby. Any questions from faculty or former students or attendees? No, well, thank you both for being here. We really appreciate it. And now, do we have any questions in general? Nope. Okay. Well, thank you everybody for being here. I will put in the contact information, and I am available for one-on-one appointments with any prospective student. If you have any questions you would like to ask, you can email public.health@uvm.edu or learn@uvm.edu, and we will send you a scheduling link so you can meet with me one-on-one, and I'll be able to answer any of your questions. Thank you very much for being here. Thank you.